everyone, my name's Beth and today I'm going to talk to you a little bit about an injury called Achilles tendinopathy. So this video will be useful for anyone who may be experiencing pain or stiffness in and around the back of the ankle area, around the Achilles tendon. This may be worse when you first wake up in the morning and then get easier after about 10-15 minutes. And same again when you're exercising, may be worse when you first start and then get easier. It may be quite tender to touch as well around the Achilles and may be quite sore the day or two after you run. So if you're experiencing any of these symptoms, then one of the possible injuries it could be is a condition called Achilles tendinopathy. So first I'm going to talk to you a little bit about the anatomy of the Achilles tendon. So basically, the Achilles tendon attaches both of the calf muscles, which are called the soleus and gastrocnemius, to the heel bone. So the gastrocnemius crosses the knee and the soleus doesn't cross the knee. They go into the Achilles, attach onto the Achilles tendon, and then they attach onto the heel bone. So this basically means that the Achilles tendon transmits forces from the calf muscles to the heel and through the foot, so we are able to push off and flex the foot during walking, running, jumping and activities like that. So a couple of the main causes for Achilles tendinopathy include overloading the tendon or perhaps a dramatic increase in load to the tendon. So for example, if you're a runner, suddenly upping your miles, your distance in a short period of time may bring this condition on. Also changing training surface. So for example, training on a soft surface like grass to then training on a more hard concrete surface. Also, other things that may bring it on is inadequate footwear, so poor supportive trainers, and also tight or weak calf muscles may bring on this condition. So basically, Achilles tendinopathy happens when the tendon is overloaded and it can't basically cope with the load being placed upon it. And what it does, first of all, the tendon tries to adapt to this increased load, and how it adapts is basically cell changes within the tendon, and this can increase water retention. And this water retention basically can make the tendon more thick. So sometimes with people that have Achilles tendinopathy, it'll feel quite thick and swollen around the tendon. Now this usually is because of the cell changes within that Achilles tendon. And that happens usually at the start to try and adapt to the load. But if the load is still being placed upon the tendon and it's not having time to heal and adapt, then what can happen is degenerative changes, and this can make the tendon quite weak and vulnerable and increase the risk of perhaps leading towards a rupture of the tendon. Now that is, more in the chronic cases. So moving on to the next part of the treatment techniques for Achilles tendinopathy. And the first thing that I would recommend is easing off any aggravating activities. So anything that makes the pain in your Achilles worse, try and avoid or at least decrease. Now, running is most likely going to aggravate that pain around the Achilles tendon. So if you're someone who has recently increased their miles in a short amount of time, then I would advise decreasing those miles again. I'm not saying completely stop, but try and ease back on that running just to allow time for that tendon to recover and heal. I'd also advise changing one of the runs with another type of activity, for example, a cycle or a swim, or even a strength training session. And even incorporating some more recovery days. So for example, going on a recovery walk or doing a recovery stretching session or something like that. The next thing I'd recommend doing is using ice. So ice is a very good pain relief. So if your Achilles is particularly sore one day and after activity or exercise, then apply some ice around the back of the Achilles for about 10 to 15 minutes, and you can do this up to 3-4 times a day. The next thing that I'd recommend doing is foam rolling your calves. I'd recommend foam rolling over stretching just because stretching may put extra tension through the tendon. Now you can use a foam roller or a tennis ball or a massage ball, or even if you've not got any of that, you could use an alternative like a firm water bottle or something like that. Now you want to make sure you massage or foam roll the bulk of your calves, so not over the Achilles tendon, otherwise that will probably make it more sore. Pop your foam roller or your massage ball or whatever you've got underneath your calf. Put your weight onto your hands and the other leg, and then just put as much weight really as you want through that calf, changing the angle nice and slow and getting into those tight spots. If you want a little bit more, you can put that other leg over the top to add a bit more pressure. I'd recommend doing this every other day for about 2 to 3 minutes. So another thing you can do to help relieve some of the pain while you're running or doing any other activity is using K-tape or sports tape. So you can buy this from Amazon or eBay, just your simple K-tape. And what this can do is basically just help support the area and help with pain and also help with muscle function around the area. So I'm going to show you a simple taping technique that you might want to adopt and might want to use when you next go out running, and see if it can help with some of the pain that you're experiencing. So what you'll need, also you can use, so I buy this kind of pre-tape spray from Amazon, and it's really good at putting on before you spray, before you apply the tape, and it makes the area much more sticky so the tape stays on a lot longer. What you'll need is basically a long strip, so measure out from the bottom of your heel up to about mid-portion way to your calf. However, I've got a pre-cut strip here and it's a little bit short, so make sure it goes up to about midway to your calf. You want 2 strips of that size, and then one of the strips you want to cut in the middle, so it's kind of about 2 strips. And then you want one little piece about this size to go around the main part of your pain. So I'm going to demonstrate how to apply it on a chair because I'm very organised, if you can still see me. So basically you want to get the strip first of all, your long strip without any cuts in. You want to do it with your foot flexed, okay? So try and keep it flexed the whole time. You want to tear a little bit off and make sure, so basically tear off the first bit of the tape, and this is going to go onto your heel, still with your foot being flexed. So don't put any stretch on, just put a little bit, about kind of 5-6 centimetres of that tape onto your heel, rub it down with your finger like that. Now this piece of tape is going to have no stretch on it, so take off the back of the paper, and you're going to basically put it, the back of the heel, with your foot flexed, along the Achilles, flatten it down as you go, no stretch, and then up along the calf, like that. So if you can see, like that. But as I said before, you want it to go a little bit higher up than mine, all from demonstration. Then take your next bit with your two flappy bits, and again, take off that first bit so you've got the tape showing. Again, flex your foot, put that part over the other part, the bottom of your heel, rub it down with your finger. Then you're going to take one strip and you're going to apply about 75% stretch. So if you take the paper backing off, so 100% stretch would be as far as it goes, take it down to about halfway and then increase it a little bit more. This is going to go around the side of the tape, so on the inside of the leg to start off with, and then you're going to do it on the other side around the outside. So that comes along the inside, and then the other one, again 75% stretch, take it off, 100%, take it down a bit, increase more. This is quite tricky to do this side. Round the side of the other bit of tape and up to the top. And then flatten it down on the sides as you go. Make sure, I didn't say this, make sure you don't put any stretch on the end bits of the tape, otherwise it's more likely to come up. Also a tip I forgot to say is to round the edges of your tape as well, that will stop it coming up. Last bit, still keeping your foot flexed, you want a little bit, and you want to put this on the site of your Achilles that has the most pain and discomfort. So basically have a little feel around and see which part is the most tender point. And what you're going to do, you're going to take it off, take the paper backing off, and you're going to basically take the paper backing off either side like that, so you've got the middle bit showing, and you're going to put, again, about 75% stretch on it, so stretch it all the way out, take it halfway, put a little bit more stretch on. You're going to put it on that painful area, and then make sure the sides don't have any tension on when they go down, like that. So I'll show you my tape. That's what it should look like. So the final treatment technique that I'm going to talk to you about today is eccentric exercises. Now, every exercise has a concentric phase and an eccentric phase. The concentric phase is where the muscle contracts and shortens, and the eccentric phase is where the muscle lengthens, and this is the part that we want to concentrate on with tendinopathy, that lengthening of the muscle and the tendon. And the exercise that we're going to use is heel drops from a step. This is shown to be very beneficial in research, and the aim is, if you're experiencing pain in one ankle, one Achilles tendon, you want to come up on the good leg and come down on the bad leg. So we're just focusing on that lengthening phase on the bad side. So find yourself a step or a platform to let your heels drop off of. And you can hold on to if you want, hold on to something if you want to, and I'm going to use the running machine. So you want to let your heels hang off, so just on the balls of your foot. Now, if it was my right leg that was painful, I'd want to come up on my left and down on my right. So I'd want to come up on my left side, shift the weight over, and come down on the bad leg. Come up on the good leg, come down on the bad leg, and let that heel drop all the way down. Now you want to do this with straight and bent legs. So after you've done it with straight, do it with bent. So coming up on the good, coming down on the bad. Coming up on the good, coming down on the bad. You want to do it with both straight and bent legs to basically focus on both of those calf muscles. As I said before, one of them crosses the knee and one of them doesn't. So doing the exercise with bent and straight legs will focus on both of the calf muscles attaching into the Achilles tendon. Now, that exercise may be a little bit too much, single leg off of a step. So if it is, take it down to the floor. So still doing single leg if you can. You want to basically come up on the good leg, come down on the bad leg. Come up on the good, down on the bad. Now, if that's still too much doing single leg, you can do it double leg and using a chair. Now, this is also good if you're experiencing pain in both sides. So using the chair to help you up, pushing on the chair to help you up, and then lowering down. Pushing on the chair to help you up, and lowering down like that. So you're just going to have to take the right option for you. And if anything's too painful, just take the easier option. You might find you have a little bit of discomfort through the exercise, but that's absolutely fine. But if it's kind of going above a kind of 4, 5 out of 10 pain on the exercise, then take the easier option or stop. Research has also shown that incorporating load to the exercise is very beneficial. So if you've got a pair of dumbbells at home, or maybe use a rucksack and fill it with a bit of weight to just increase the load to the tendon, but not too much to start off with, just a little bit of extra load. Now, the exercise dose for this exercise is basically suggested to be 15 reps and 3 sets twice a day. So you want to be doing 15 reps of the straight leg heel lowers, 3 rounds, so 3 sets, and then 15 reps of the bent leg heel lowers, 3 rounds twice a day. Now, I know that sounds quite a lot, but in research it is shown to be very beneficial. Now, after about 4 to 6 weeks of the lowering phase of the exercise, you want to progress onto doing full heel raises and lowers. So working on both the concentric and the eccentric phase, if you can and if pain tolerates. So what I mean is basically by going up and down on the same leg. So for example, if you're working single leg, you'd be going up and down on the same side. Or if you need to take it down to the floor, you can. Or if you need to take it to both legs, up and down, up and down. And again, straight legs, bent legs, 15 reps, 3 sets of each exercise twice a day. So that's quite a lot to take in today, but just to recap the treatment techniques that I would advise for Achilles tendinopathy is 1, avoid any aggravating activities and ease back off of the running. 2, ice the affected area, especially after exercise for 10-15 minutes. 3, foam roll the calves or tennis ball or some kind of foam roller alternative. 4, use the taping technique that I showed you. Might be quite beneficial when you're out running or doing exercise. And 5, the eccentric exercises that I showed at the end. So I hope that was beneficial today and I hope you all learned something. If you've got any questions, please leave them in the comments and I'll be happy to answer them. Thank you very much.